Every year, millions of seniors undergo routine health checkups, believing that it is the right choice to protect themselves. But have you ever imagined that some of these routine tests could be secretly increasing your risk of stroke in unexpected ways? It may seem unbelievable because we trust our doctors and follow their recommendations. However, hidden deep within the modern health system are risks that are not mentioned, not in the newspapers, not in the clinic literature, and sometimes even in the silence of your doctors. Imagine leaving your annual checkup feeling reassured, only to suddenly experience dizziness, blurred vision, or other more serious symptoms, leaving you wondering what happened. The truth is that some tests, especially when performed regularly or in the presence of certain health conditions, can cause a sudden increase in blood pressure, disrupt blood circulation, and lead to a dangerous chain of events. But don't worry, our goal isn't to scare you. It's to help you ask smarter questions and protect yourself and your loved ones. After 60, early detection is important, but avoiding unnecessary risks is even more important. We'll explore the 5 most common medical tests that can carry hidden stroke risks and how to protect yourself before your next appointment. Some seemingly harmless medical tests can pose significant risks to older adults if not carefully considered. The first is CT scans with contrast. Contrast helps doctors see blood vessels, organs, and tissues more clearly, but in people over 60, especially those with high blood pressure, heart disease, or kidney failure, it can put pressure on the cardiovascular system. Some people experience vasovagal reactions, which cause a rapid drop in heart rate and blood pressure, causing dizziness, nausea, and fainting. Others experience a sudden increase in blood pressure, constriction of blood vessels, and an increased risk of stroke or heart attack. Research published in the Journal of Vascular and Interventional Radiology found that older adults with a history of heart disease, high blood pressure, or kidney failure had a higher rate of vascular complications after CT scans with contrast. Case in point, an 81-year-old man had a routine abdominal CT scan, which came back normal, but 2 days later he had a mini stroke, suspected to be caused by a temporary increase in blood pressure from the contrast dye causing a blood clot. A CT scan with contrast isn't always dangerous. It can detect cancer, blood clots, and aneurysms, but it should only be done when absolutely necessary. Before agreeing, ask your doctor if the test is necessary, if there are safer alternatives, and provide a full medical history and drug allergies. Sometimes a plain CT scan or ultrasound is enough to make a diagnosis. The second test is an exercise stress test. On the surface, this is a way to check the heart while exercising. The patient wears an electrocardiogram, walks or runs on a treadmill to monitor the heart's response. For healthy people, this may be a normal test, but for people over 60 with heart disease or high blood pressure, increasing the speed causes the heart rate and blood pressure to spike, creating a sudden large pressure on the heart and blood vessels, like lighting a fire on dry dust, which can easily lead to serious incidents. Risks include sudden increases in blood pressure, heart rhythm disturbances, and less commonly, say, ruptures of weak blood vessels, especially in the brain. A study published in the American Journal of Cardiology analyzed more than 1,300 patients over 60 who did stress testing and found that nearly 7 experienced incidents such as high blood pressure or arrhythmia. This is a remarkable number, especially in people with pre-existing vascular disease. The common point of both tests is that they are highly diagnostic but carry significant risks for older people. The important lesson is that they should not be performed out of habit or to be sure during a routine checkup, but should be weighed against the benefits and risks based on the individual's condition. Patients should proactively discuss with their doctor, is this test really necessary for my condition? Is there a safer option? At the same time, it is necessary to provide complete information about medical history, current medications, and previous allergic reactions to minimize risks and protect long-term health. The study found that nearly 7% of participants experienced adverse events during the stress test, such as a sudden increase in blood pressure or arrhythmia, especially in those with pre-existing vascular disease. Elizabeth, 74, from Ohio, was diagnosed with high blood pressure during a routine checkup and was asked by her doctor to undergo a treadmill stress test. While doing it, she felt dizzy and had chest pain and had to stop. The next day, she suffered a mild stroke. Doctors believe that the sudden increase in blood pressure during the test ruptured a small blood vessel in the brain. Although the test did not directly cause the stroke, it put pressure on the already vulnerable cardiovascular system, causing the condition to exceed the threshold of tolerance. Therefore, so older adults should discuss carefully with their doctors, ask about safer methods such as drug stress testing or resting echocardiography, and consider whether the test is really necessary if there are no obvious symptoms. Next is endoscopy, a common procedure after age 60 to examine the esophagus, stomach, or colon. However, if not absolutely necessary and sedation is required, the risks may outweigh the benefits, especially in people taking anticoagulants such as warfarin, aspirin, or Plavix. Sedatives alter blood pressure and circulation, combined with drugs that affect blood clotting. They can increase the risk of internal bleeding or brain circulation disorders leading to silent stroke. A 2021 study in the journal Gastrointestinal Endoscopy found that people over 60 who underwent endoscopy with sedation had a higher rate of transient ischemic attack, TIA, after the procedure. A typical case, a 76-year-old woman, healthy, had a routine colonoscopy, slurred speech, and loss of coordination after the procedure, confirmed to be a mini stroke. The suspected cause was a drop in blood pressure due to sedation combined with her daily aspirin, which caused the clot to move. Therefore, the elderly should only agree to endoscopy when there is an urgent reason. Fully inform about the medications they are taking. Ask clearly about the possibility of having to stop anticoagulants and the risk of sedation. You can request a procedure without sedation or light sedation if you are concerned. Finally, an MRI, a powerful tool to detect disease early and avoid unnecessary surgery. But when using contrast agents containing gadolinium to make image clearer, caution should be taken in the elderly or those with kidney problems. Gadolinium is excreted through the kidneys, but kidney function declines with age. And if kidney disease is not detected, this metal can remain, causing nephrogenic systemic fibrosis, NSF, a rare but serious condition that thickens and hardens the skin, connective tissue affecting movement, breathing, and internal organs. More worryingly, residual gadolinium is also found in brain tissue, which can be associated with neurological symptoms such as confusion, dizziness, disorientation, especially in people who are already at risk of poor circulation. A study published in Radiology that followed more than 2,000 patients over SIP who underwent MRI with gadolinium showed that these effects should be considered. Therefore, before agreeing to have an MRI, with contrast, you should have your kidney function tested and ask your doctor about alternatives or imaging techniques that do not require gadolinium. In short, many tests routinely recommended for people over 60, such as stress testing, sedation endoscopy, and MRI with contrast all have potential risks if not carefully considered, especially in groups with underlying diseases or taking medications that affect blood pressure, blood clotting, or the kidneys. The important rule is always ask your doctor for the specific reason, the level of necessity, safer options, and an assessment of the benefits and risks before performing. Within a week of having a contrast-enhanced MRI, about 5% of patients report stroke-like symptoms, such as headaches, blurred vision, loss of balance, or visual disturbances. These aren't full-blown strokes, but they can be warning signs, especially in people with kidney disease, whether or not they've been diagnosed. George, a 79-year-old veteran from Arizona, is a case in point. His doctor ordered a contrast-enhanced MRI to check for persistent back pain, but he didn't know he had stage 3 kidney disease. A few days after the scan, he felt dizzy, weak, and had memory problems for nearly a week. Later tests revealed his kidney disease. George says that if he had been warned, he would have asked more questions. The lesson? When you're offered a contrast-enhanced MRI, ask your doctor if it can be done without contrast, and if it's required, get a kidney function test, GFR, first. Also, tell your doctor if you've had any unusual reactions to previous scans. MRI itself is harmless, but the contrast dye can be harmful if the body does not process it properly. Next up is carotid ultrasound, a seemingly harmless test that makes sense to do on a regular basis. This quick, non-invasive procedure uses no needles or dyes and is often used to detect plaque in the carotid arteries, the main vessels that carry blood to the brain. Over time, plaques in the arteries can narrow due to cholesterol or calcium, which is common with aging. However, not all plaques need to be removed. In many cases, it is safer to monitor them than to operate. The problem arises when the ultrasound shows a 50 to 60% narrowing, even though the patient has no symptoms such as dizziness, blurred vision, or muscle weakness. This can lead to a referral to a vascular surgeon who may recommend procedures such as an endarterectomy or stenting, which may not be beneficial compared to medications and lifestyle changes. A large study published in the New England Journal of Medicine that followed more than 3,000 older adults with asymptomatic moderate carotid stenosis found that surgery did not significantly reduce the risk of stroke compared with medical treatment, and that a small percentage of patients had strokes due to the surgery itself. The story of Dorothy, she from Pennsylvania, is a cautionary tale. She was healthy, had an ultrasound showing 65% stenosis, underwent surgery within weeks, and suffered a minor stroke during the procedure, leaving her with weakness on one side of her body. In short, both MRI with contrast and ultrasound of the carotid arteries in the absence of symptoms should be considered carefully. Older adults should ask about the need, risks, and safe alternatives before undergoing surgery to avoid serious complications. The bottom line is, not all tests are dangerous, but not all tests are absolutely necessary, especially after age 60. Older people's bodies react differently, so seemingly simple procedures like contrast injections, sedation, or ultrasounds can have unexpected effects if your circulation, blood pressure, or kidneys are already weak. So pause and ask, is this really necessary? Are there safer options? If you're stable with medications and a healthy lifestyle, it's sometimes safer to monitor and recheck regularly than to intervene immediately. Everyone has the right to have the purpose of the test explained clearly, the impact on the treatment plan, and always consider a second opinion before a vascular procedure. Informed decisions lead to better outcomes and peace of mind. Your health is your story, and your voice matters. Here, we believe every good choice should be guided by knowledge, not fear or habit. If you've ever felt strange after a scan or test or watched a loved one go through something unexpected, drop a 1 in the comments. And if this video helped you feel a little more aware, more in control, or just more curious, subscribe to Zen Health. We're here to uncover the truth, ask the hard questions, and always prioritize your well-being.